Brothers and sisters, warm greetings from Sri Balaji Vidyapith, popularly referred to as SBV. I am delighted to meet you all once again through Channel 1. I thank you for your continuous support in this endeavor. Today's topic is important in the context of conferring holistic health on world citizens, namely global health. Global health as an entity denotes essentially an area of academics, research and practice that is synonymous with providing the topmost priority in the realms of enhancing health and achieving health equity for all people worldwide. This definition has an inherent broad focus on health improvement and health equity. Global health is a recently established branch of health sciences that has sprouted from medicine, public health and international health. Global health emphasizes transnational health issues, key determinants and most importantly solutions. This all-pervading phenomenon involves several nodal disciplines both within and beyond the gamut of health sciences and promotes interdisciplinary collaboration. Global health, hence, could be aptly regarded as the synthesis of population-based prevention with equal impetus on individual level robust clinical care. Globally, the rate of mortality pertaining to non-communicable causes such as heart disease, stroke and injuries is rapidly increasing. Having said that, it needs to be realized that the number of deaths resulting from infectious diseases, namely malaria, tuberculosis and vaccine preventable diseases is decreasing exponentially. I need to emphasize that public health professionals get more involved at grassroots levels within the country. On the contrary, the health professionals and policymakers in global health mainly focus on the problems in the realms of healthcare and policy issues across national borders, that is, on a global level. The discerning students of global health often learn as to how the nodal international agencies propagate the significance of individuals by drawing the attention to providing increasing access to health care. The bottom line is that we need to ensure immaculate health standards around the globe. International health lays emphasis on the health of participating countries with the thrust on global health in promoting health besides preventing and treating diseases for all the people in the world. Cardiovascular disease, stroke, cancer, diabetes mellitus and many other non-communicable diseases account for nearly 70% of all deaths worldwide according to the WHO. It has been uniformly agreed upon by the policymakers that there are 6 major issues that are of immense relevance and significance. Instances of pandemics include influenza outbreaks, COVID-19, and other pronounced viral threats. These threats expose our susceptibility to widespread diseases, and many such diseases have their genesis in animals. Vaccination could alleviate distress to a large extent, and global risk mitigation measures need to be in proper place, especially after an outbreak. Environmental factors hold the key to several possibilities, and hence global health must necessarily focus on the environmental challenges confronting the world community. Economic consideration and access to health care. In order to help solve the economic challenges, global health professionals must necessarily explore opportunities to alleviate the distress of marginalized and underprivileged communities. In key public health and urge healthcare professionals to render services in the rural areas. This could go a long way in conferring optimal benefits in the long run. Political factors also play a major role, especially in the context of providing quality health care to the migrant and refugee populations. We need to take due cognizance of this fact. It is disheartening to note that more than 80% of non-communicable diseases occur in low and middle income countries. This needs to be effectively addressed. Quality education plays a pivotal role in the prevention. With several pathogens originating from animals, veterinary medicine acquires great relevance, and hence this fact needs to be taken into due account while providing need-based solutions.
Greetings from Sri Balaji Vidyapeeth. July 1st of every year is celebrated as Doctors' Day in India. The day signifies the birth and death anniversary of Dr. B.C. Roy, one of the noblest ever doctors and a wonderful son of Mother India. MGMCRI, a constituent teaching unit of SBV, conducted the Doctors' Day 2022 in a manner befitting the ethos. 8 eminent and stalwart faculty members were honored at a glittering and colorful ceremony held on the 12th of July at the conventional BC Roy Hall, MGMCRI, SBV, that is virtually synonymous with the best of the functions that MGMCRI and SBV conduct in the portals of our institute. By honoring the eminent faculty members, namely Professor A.C. Parija, the Honorable VC of SBV, Professor N. Ananthakrishnan, Dean of Faculty SBV, Professor M. Ravishankar, former Dean of MGMCRI, and presently the Director of Sea Dreams, Professor Robinson Smile, Eminent Professor of General Surgery, Professor R. Narasimhan, Eminent Professor of Pathology, Professor K.S. Reddy, Professor of Radiation Oncology, and Eminent Professor, Professor Gopalakrishnan, the Eminent Professor of ENT, and Professor Habibullah, the Eminent Professor of Obstetrics and Gynecology. SBV has bestowed the honor upon itself, I should say. The event was coordinated so very well by Professor Sitesh Ghosh, Dean MGMCR, and ably assisted by the Vice Principals, namely Professor C.P. Ganesh Babu and Professor S. Padmavati. His Excellency Yu Mo Kyo Aung, the Ambassador Extraordinary and Plenipotentiary Embassy of the Union of Myanmar, New Delhi, and Mrs. Nilar Aung, the First Lady, Embassy of the Republic of Union of Myanmar, honored us with the eminent visit to SBV on the 15th of July 2022. Bilateral endeavors aimed at student and faculty exchange figured in the 45-minute discussion. Professor A.C. Parija, the Honorable Vice Chancellor of SBV, and Professor N. Ananthakrishnan, the respected Dean of Faculty, and other senior functionaries from SBV and MGM Healthcare Chennai participated in the high-level meeting in the presence of His Excellency, the Ambassador of Myanmar in India. Sri Balaji Vidyapeeth, deemed to be university accredited with the A2+ grade by NAC, Pondicherry, and Pallium India Trust, renewed the Memorandum of Understanding. The formal ceremony was held in the boardroom administrative block SBB on Wednesday, the 20th of July 2022. The internationally acclaimed founder chairman of Pallium India, who is reverentially addressed as the father of palliative care in India, Dr. M.R. Rajagopal, and Professor A.R. Srinivasan, the registrar at SBB, signed the renewal of MOU on behalf of Pallium India and SBB respectively. Professor S.C. Pareja, the Honorable Vice Chancellor of SBB, and several top functionaries from both sides participated in the event that lasted for approximately 30 minutes. SBB continues to be in the limelight for its immense contributions in the domains of academics, research, patient care, outreach, and extension services. Open House affords an excellent avenue for the Guest Institute to explore the myriad facets of SBB. The avid students of PSBB Millennium School, Kadalur, visited SBB on the 20th of July 2022. A brief but impressive curtain raiser was held at Maulana Azad Bapuji Central Library SBB, and this was succeeded by the visit of the students, which signified the excellent open house that allowed the Guest Institute to explore the multitude of opportunities that are being offered in the portals of SBB.
The Honorable Indian government has launched several impressive and important schemes, including Sabka Saath, Sabka Vikas, Sabka Vishwas, and Sabka Prayas. These account for the largest vaccination program in the world. This has come at the right time, wherein COVID-19 crisis has affected the global population, which has culminated in disasters of the mankind. The citizens of India also have a great role to play. India can be a world leader in providing global health once the citizens are healthy. This is extolled by the phrases. For a Samruddh Bharat, we need a Swasthya Bharat, and for a Swasthya Bharat, we need Swasthya Nagarik. The Health in India and Heal by India are excellent initiatives of the Indian government that are poised to enhance global health seamlessly. The effort of the Indian government are laudable, and especially those that support the ongoing efforts of TB eliminations, cataract, etc. The initiatives on telemedicines and e-Sanjeevani are great steps towards holistic health, and thus in the long run could pave the way for global health. Various other initiatives are available at the regional level, and these motivate citizens to volunteer in large numbers and become an essential components of these campaigns that would be fostered through active participations of the Indian citizens. I wish you the best of health. Do remember to continue practicing physical distancing, wearing masks, and strictly adhere to hand hygiene. Stay safe. God bless you. Jai Hind.